Let's get started with the endocrine and reproductive system dissection. What we're looking at here is the sheep brain. So I want you to know some structures with the sheep brain. This ball-looking structure here that the probe is circling, that is the thalamus. This triangle structure here is your hypothalamus. So your thalamus, hypothalamus, this is the infundibulum right here. This is the pituitary gland. This is the pineal body. Thalamus, hypothalamus, infundibulum, pituitary gland, pineal body. This sheep brain right here, we can see the thalamus, hypothalamus, the triangle here, infundibulum, right there, pituitary gland, pineal body. Remember that your hypothalamus is secreting, releasing, and inhibiting hormones which control the secretion of the pituitary gland hormones. So, thalamus, hypothalamus, infundibulum, pituitary gland, pineal body right there. Next, we have the thyroid gland, and we'll go over to the cat right here. So, if you look right here, this is the cat's head and neck region. We have the larynx right here. We have the cricothyroideus muscle right here. And then right here, we have the trachea, or windpipe. Okay, so this structure right here is your thyroid gland. And we see a vessel that's coming off your common carotid artery right here. This is your common carotid artery. And then we can see this artery that's supplying your thyroid gland. And we see the thyroid gland on the other side as well. Right there. And we can see the thyroid gland right here on this next cat. It's a little bit better picture here. So here's your thyroid gland. Right there. Thyroid gland. And this is, again, your cricothyroideus muscle, trachea, thyroid gland. Okay, I want to show you the thymus gland. So the thymus gland is within your thoracic cavity here. So here's your thoracic cavity. You can see your lungs. You can see the heart covered by the pericardium, as we see here, within your mediastinum. You can see the other pleural cavity right here. So we see the lungs within the pleural cavity. Here and here we see the heart right here within the pericardial sac here of the mediastinum. And we can see this structure right here. Look at the probe where it's circling. This structure right here is going to be superior as well as anterior to your heart within the mediastinum of your thoracic cavity, that is your thymus. That is your thymus. It's going to be larger in young mammals. So there's your thymus. This structure right here, again, remember that's your thyroid gland. And then you have your thymus. Let me show you on the rat here. You can see it a little bit better. So you can see the rat here. You can see the heart. You can see your thymus right here. That's what I'm circling. The thymus gland. It's going to be both superior and anterior to your heart. Okay. Next, let's do the adrenal gland. So, let me show the adrenal gland here. So, if you look in the abdominal pelvic cavity, so you can see the cat right here. You see the thoracic cavity right here. You see your diaphragm muscle, which separates your thoracic cavity from your abdominal pelvic cavity. You can see the spleen right here. And you can see the kidney right here. So, hopefully you can see the kidney. And we can see the adrenal gland right here. We see this structure right here. That's your inferior vena cava. We see the renal vein right there. And the renal artery would be right here. So this structure right here would be the adrenal gland. On this cat right here, it shows much better. So we can see the abdominal pelvic cavity. We have the intestines moved back here. We can see the spleen right here. This structure right here is your spleen. And we can see, again, your kidney, your renal artery, your renal vein, your renal vein, and then your renal artery right here. So let me show that to you. So right here we can see the renal artery and renal vein. Renal artery is red, renal vein is blue. Now we can see right here, can you see that? Hopefully you can. This is the adrenal gland. This is the adrenal gland of the cat. Adrenal gland. This is the inferior vena cava, right here. And then this right here is your abdominal aorta. So abdominal aorta and inferior vena cava. So we can see everything I just showed you right here. Okay. Now, another structure I'll show you is the ureter. So you can see the ureter here, kidney, renal vein. The ureter is going to be going down through here, and it's going to then connect to the bladder, the urinary bladder, like we see here. Okay, now Let's do the pancreas, the next one. The pancreas is sort of hard to see, and right here, let me show this to you. If you look, maybe it's better like this, yeah. If you look like this, you can see that you have your liver, you can see your stomach, and if you look at the very end of the stomach, you can see the pyloric region, which will be right in here. And let me expose the pancreas here. So you look for the pyloric region of your stomach, which would be right in here. And then you can see the first part of your intestines, your small intestines. Now that would be where the pancreas is. So the pancreas is going to be this glandular structure that's going to go all along through here. It's going to basically be retroperitoneal, and it's going to secrete its contents, the pancreatic juice, into the duodenum, which is right in here. So there's your pancreas. On this cat here, let's see if it's better here. So we can pretty much see the same thing here. So here's your pancreas right here. Here's your pancreas. Okay. Now, let's move on to the ovary and the testis. So, we have the female cat right here. So here's your female cat here. Let me turn around this way. Maybe that's better. So this is the abdominal pelvic cavity, and we can see that you have the rectum right here, and we can see that right here you have your ovary on the left side. The ovary on the left side. Over here on the right side, you have another ovary. So you can see the right and left ovary. Now, you notice that with the cat, the uterus is bifurcated. So here's a right uterine horn here, and then the left uterine horn here. And here we see the body of the uterus right in here, and then it's going to go down into the vagina right here. So another thing I want to point out to you is the broad ligament. That's this clear, sort of clear looking stuff right here. That's the broad ligament, and you can see the broad ligament right here. Now, I don't know if you can see this or not, but you can see blood vessels, just barely. If you look at this ovary here, so here's the right ovary. You can see blood vessels, the ovarian artery and vein that's going toward this ovary. And you can see a little bit better on this side. There you go. Ovarian artery and vein. Okay? And right here we can see the urinary bladder. You can see the urethra, vagina, and then the rectum. Urethra, vagina is the next one. And then the rectum. And then the uterus, body of the uterus, uterine horn, ovary, and ovary. Broad ligament. Okay? Now for the male, we can see the testis right here. This structure right here is your epididymis. And this structure right here is your spermatic cord, which I accidentally cut. So testis, the epididymis, spermatic cord, which is going to include your vas deferens and your testicular artery and vein. So here's your testicular artery and vein right here. You can see a little bit of the testicular vein right here is blue, but you can see mostly the testicular artery right here. Testicular artery and vein. We see the vas deferens right here, and we can see the vas deferens on this side as well. You can see that vas deferens, vas deferens. Now the testicular artery and vein are going down into this canal here called the inguinal canal. This is the inguinal canal where the probe is at. Inguinal canal. Here and here. And then you can see the spermatic cord right here, which houses the vas deferens and the testicular artery and vein. Right over here, you can see the scrotum right here. Here's your scrotum. And this structure right here, this is the urethral opening where both semen and sperm come out. Urethral opening. Okay. And let's see, what else do we have? Let's do the nerves. Let's do this cat. I'm going to go through these nerves real quick. So, where we're in the arm region, as we see here. And if you look right here, we can see the brachial plexus. And I want you to know three nerves. You have your ulnar nerve right here. You have the median nerve. Picked up the wrong one. The median nerve is right here. Here's your median nerve right here. Median nerve, and you can tell the median nerve which one it is because it's going to have two cords to it, median and lateral cord. So there's your median nerve right there. And then this biggest nerve right here is the radial nerve right here. Ulnar, and then you have your median right here, and then you have your radial nerve right here. And then on the leg, we have the sciatic nerve, the fibular nerve, and the tibial nerve. Sciatic, fibular nerve, and tibial nerve. And right here, just in case I didn't get it, we have the ulnar nerve, we have the median nerve, it's hard to get, right here. And then your radial nerve is right here. And then you'll learn these later here. Right here, we have the brachial vein. And then right here, this red vessel, brachial artery. Okay, let's do the vagus nerve. To look for the vagus nerve, you look in the thoracic cavity here. So here's your vagus nerve, and it's going to be one of the 12 cranial nerves in this parasympathetic division of your ANS. And it's going to pierce the diaphragm and go innervate the digestive organs like the intestines for parasympathetic division of your ANS, autonomic nervous system. Okay, let's move on to the male and female structures, which I've already showed you a lot of already. So we're going to do the male first. So let me go through this real quick here. So you should know already, this is your kidney. This is your ureter right here, which is going to connect to the bladder right here. And then we have the urethra right here. And then we can see the urethra going down, and we see the penis right here. Here's the penis right here. Penis right there. Okay? And then I've already showed you the urethra opening right there of the penis. Okay? We have the testis here, epididymis, inguinal canal, testicular artery and vein, vas deferens here, testicular artery and vein on this side here. Inguinal canal again. We see the scrotum here. Remember that the inguinal canal is going to go down into the scrotal sac. Okay. Let me show you on the rat some things. I don't know if you can see this or not. I looked at the wrong one. This one. Let's just go over here. So, if you look at the rat, we can see the undissected rat right here. You can see the urethra opening here, and you can see the scrotal sac right there and right there. Hopefully you can see that scrotal sac right here. Scrotal sac, left and right. Okay, now right here you can see the scrotal sac has been cut open, and you can see the testis and the epididymis. Can you see that? So, testis is this structure right here. Epididymis is right here. Now, here you can see the spermatic cord. See that? Going down into the inguinal canal. Testicular artery and vein is this right here. And then you can see the vas deferens right here. Okay? Now, let's see what else. Oh, I want to show you these structures here while I'm here. These two structures here, which are sort of hard to see, this is, well, there's two of them. You got this one here and this one here. Those are the seminal vesicles. Seminal vesicles here and here. This is the urinary bladder here. Seminal vesicles here and here. Okay. Now for the female. I think I've showed you everything for the female, but real quick I'm going to show you again. So, we can see the ovary right here. You can see the uterine horn right here. Body of the uterus, vagina, urethra, bladder. And right here you can see the rectum. Urethra, vagina, rectum. Urethra, vagina, rectum. Okay? I want to show you some things here. For the undissected female rat, you can see the urethral opening right here. Right there, urethral opening. And then you move that back a little bit and you can see the vagina. Right there. Urethral opening, vagina, anus. On the male, urethral opening, scrotal sac, here and here. Okay, now this looks like a mess right here, but this is a pregnant rat, and you can see that most of the fetuses have been removed. You can see that I have cut open the uterine horn and exposed a fetus here, and we can see this is a fetus, and right here I have this structure. This is the placenta right here. This is the placenta. This right here is a fetus covered by the amniotic sac. Placenta, fetus covered by amniotic sac right here where the probe is. And then right here we can see the fetus here. Umbilical cord here. And placenta. Fetus, umbilical cord, placenta. And that is it of the endocrine and reproductive dissection.